The 988 number is a very, very good tool, and it's greatly expanded. It not only takes into account suicide, but it takes into account any kind of mental health crisis, any kind of substance abuse issue. It's still a great resource for veterans. You dial 988, you press number 1, and you're transferred to hopefully a military person, but if it's not a military person, it will be someone that's very familiar with crisis intervention and military culture. Also, veterans can do a chat, veteranscrisisline.net/chat, or they can text 838-255 from their cell phone, and they could do a text conversation with a mental health expert that is familiar with military culture and crisis intervention. If you have a crisis, you can call 988, crisis intervention, mental health issues, or substance abuse issues. If you feel like you're going to hurt yourself, someone else, or even end your own life or someone else's, I would basically call 911 first. You would call us if you have non-emergent psychological issues, like I said, depression, anxiety. If you and your spouse need marriage counseling, you would call our 301 number. It's a hotline that gets answered by a doctor, and he would get you the help you need within a day or so because it's not emergency. But when you call the Addiction Services hotline, you get me, and I treat it like it's an emergency and get you in treatment that day or the next day. There's been a gigantic uptick in mental health issues and substance abuse issues. We all think we're back from the pandemic, but psychologically speaking, we're not really back from the pandemic. We're getting there. But people still need help with mental health issues and with substance abuse issues, and my numbers prove that there's many people out there that still need the help. And we're here to provide it for them.